Let's continue with part 31 of the nervous system. Remember to start in order to get the best understanding of this system. In the ventral medulla, the descending corticospinal fibers travel within a tract that, when viewed in cross-section, has a triangular or pyramidal shape, which is precisely why it is called the pyramidal tract. This is also why upper motor neuron disorders are sometimes referred to as pyramidal tract disorders. At the lower end of the medulla, the motor decussation occurs. Most fibers cross to the opposite side of the spinal cord. The exact proportion of crossed versus uncrossed fibers varies somewhat from person to person, but the great majority of fibers cross over. After crossing, these fibers form the crossed lateral corticospinal tract, which runs down the lateral aspect of the spinal cord to the cervical and lumbosacral enlargements. The motor decussation is positioned precisely at the junction between the medulla and the cervical spinal cord. This location is clinically meaningful because a lesion occurring exactly at the cervicomedullary junction, such as a tumor, vascular malformation, or severe cervical fracture at this level, can produce highly unusual motor deficits. For example, arm fibers that have already crossed at this point may be affected ipsilaterally, while leg fibers that have not yet crossed may be affected contralaterally. The result can be ipsilateral arm weakness combined with contralateral leg weakness, a pattern almost impossible to produce anywhere else in the nervous system. Within the lateral corticospinal tract of the cervical spinal cord, there is also a precise internal spatial organization. Fibers destined for leg muscles are positioned laterally toward the outside, while fibers going to cervical muscles lie more medially toward the inside. The pyramidal tract is the corticospinal pathway arising from the motor and premotor cortex, descending through cerebral white matter and brainstem to the spinal cord, where it mediates voluntary movement as part of the upper motor neuron system. Motor decussation is the crossing of these descending pyramidal fibers in the lower caudal medulla. Because of this crossing, lesions above the decussation usually cause contralateral weakness, whereas lesions below it usually cause ipsilateral weakness. Most crossed fibers descend in the lateral corticospinal tract and influence distal limb muscles, while a smaller uncrossed component continues as the anterior corticospinal tract and is more associated with proximal and trunk muscles. This crossing explains classic bedside localization. Cortical, capsular, or most brainstem lesions above the decussation produce contralateral motor deficits, whereas spinal cord lesions produce upper motor neuron findings below the lesion. In the next video, we will talk about the ventral corticospinal tract and axial muscle preservation.